will declare the meeting officially open. Can I remind members, first and foremost, of the protocols surrounding electronic devices and to make sure their mobile phones are switched off. As there's nobody in the gallery, I'll not read out that part. First of all, item number 1 on the agenda is apologies. We have apologies from Joanne Dobson and Robbie Butler. No other apologies have been lodged. I would assume Trevor is coming. He'd maybe be a little bit late. Item number 2 is the draft minutes of the meeting on Thursday the 16th of June. May I refer members to the draft minutes of the meeting held on page 5 of your meeting pack? Okay, are members content with those minutes?
Yeah.
Yep. Okay, I'll just refer back to our members in the gallery. Can I also advise them to switch off their electronic devices, and they can go on to the Northern Ireland Assembly Wi-Fi if that's needed. I'll move on to item number 3, which is chairperson's business. As next week's meeting is our last before recess, I propose that we run the meeting into an informal lunch to give us an opportunity to discuss issues we may wish to explore in September. This will also allow the team to look at ideas over the summer, and we aim to wrap that up around 2 o'clock, so it would be useful if members can let us know if they can stay. As you know, we're going to have our strategic planning meeting in September, so it just gives an idea of some research that we maybe need to do over the summer months and bring that back. So are members minded to agree with that?
Okay, I won't be able to stay.
That's fine.
Go to a wedding.
So church, is it today or next week?
Next week.
Next week.
Yeah, next week. Also, can I advise members that I attended and I sponsored an event here in the Long Gallery on Monday for cancer research, and it was looking at a cancer strategy for Northern Ireland. In other jurisdictions they already have a cancer strategy in place, and they're very much wanting to see the same thing happen here in Northern Ireland. We had several scientists from Queen's University were present, and they just were reminding us of the very important work that is being done here in combating and looking at ways of treating cancer and ways of diagnosing cancer in Northern Ireland. So I know it was brought up last week. Chief Medical Officer mentioned it last week about the innovative work that was being done in Queen's University. So it was just to advise members that I attended that. It was a very good event. I think it's something that maybe we'll want to look at in the future. I know I certainly would, as part of our strategic planning, at looking possibly at a cancer strategy for Northern Ireland. So I don't know if any other members got availability to attend. It was just, I think it started in around 11:30 on Monday, but just to make members aware that that I had sponsored that. And again, it was one of those events that I had sponsored before I ever became chair of the Health Committee, and there will be numerous more I'll bring back to you and let you know. Okay, can we invite the Minister and Richard in? Excuse me. Okay, very welcome, Minister and Richard Pengelly. And can I advise members, first of all, that the Minister is here today to brief the committee on her priorities over the coming period. For reference, a copy of the department's paper on the structure of health and social care system is at page 11 to 23 of the meeting pack, and a copy of the recent statement on June monitoring by the Minister of Finance is at page 24 to 60. A clerk's memo is at page 3 of the table papers. So can I formally welcome you, Minister, and Richard, to our meeting today. I'm sure it'll be your first of many where you come and brief us. And so I can now hand over to yourself.
Thank you very much, Chairperson. And can I obviously welcome the opportunity to have to be here so early in my tenure, actually, just to set out how I see my priorities in terms of the Department of Health in the time ahead. And I'm quite sure that I will be here many times in the future, and I will look forward to a very constructive relationship with the committee, just in terms of how we take forward a number of challenges and actually how we can collectively work actually to make things better and actually transform how we do things. So I look forward to that. I think that there will be a lot, as I said, I think there will be a lot of mutual respect for the roles that we play. I think that we all have the same responsibility, certainly in terms of ensuring that we have the very best health and social care for our community, and I think that we can learn very much from the early days of the executive so far, where there is determination, I think, between both Martin and Arlene to pull together for the benefit of everyone. I think that the new programme for government approach is also going to be very helpful in terms of delivery and outcome focus, so I very much look forward to that. What I wanted to do this morning was just take this time to maybe just briefly outline my strategic aims and my priorities over the months and indeed years to come. Firstly, and I've said this repeatedly, I think I've said it in the House and I've said it at every public engagement that I've been involved with so far, that my overriding priority is going to be the transformation of health and social care services to ensure that they deliver world-class levels of care. And I suppose I can't emphasise enough at this point that the transformation programme is certainly almost always going to be about quality and safety of health and social care, achieving real and beneficial outcomes for the community. The reality is that we can't simply sustain the current model, and we have to focus on delivering the change necessary to build a sustainable health service for this and for future generations. I have recently met with Professor Bengoa and his expert panel on the reform of health and social care to get an update on that work, and I know the committee will obviously have very keen interest in that also. Professor Bengoa has no doubt whatsoever that there needs to be a shift in focus to a system that ensures that the very best experience and best outcome for patients receiving care. He's also made it clear that his report will focus on changing the way that services are actually provided, as opposed to not just being about closing hospitals and services. It's also important to note that this direction of travel has a lot of support in the clinical community, and that's certainly something that Professor Bengoa has emphasised. He's receiving a very positive response from clinicians out there in the discussions that he's had with them as part of his work. And I think that that's further underscored in the past few days whenever we've seen the BMA actually come out and said that the upcoming proposals by Professor Bengoa will provide the chance to reshape and reform the health service here, and that the chance must be seized by the Assembly. And certainly in my engagement so far with the profession out talking to staff on the front line, they are really, really keen that we actually do transform how we deliver care so we can support them more in the job that they do. So I really look forward to being able to take forward that part of work and that piece of work and working with the committee in doing so. I think that there's going to be a real opportunity for us to engage on this issue in a strategic way, and I think that we all have a realisation that if we continue to do what we've always done, then we'll continue to get what we've always got. So achieving a world-class health and social care service for everyone requires a new way of delivering services, and that undoubtedly brings significant challenges with it. In my statement on the 6th of June and the debate the following day, I made it very clear that reducing the length of time the patients have to wait for elective assessments, their surgeries and treatments is also of great importance. Excessive waiting times are totally unacceptable, but the reality is that long waiting lists are symptomatic of the challenges that are facing the HSE service, and I'm determined to address the root causes of those challenges. So I think that we can be very clear the waiting times, like many other issues, will not be resolved simply by additional funding, but if we continue to deliver services the same way, we will, as I said, continue to get the same result. So that's why I want to focus very much on transformational change. System reform and reconfiguring services is the key to sustainable improvement, but I recognise that that will not happen overnight. We must also recognise the challenges that are posed by transformation are made all the more difficult for clinicians, service users and indeed decision makers in the context of continued austerity. The consistent cut by the British Government to the Block Grant continues to put additional stress on health services and our capacity to change how we deliver our service. That said, my policy will be to adopt a balanced approach to take further short-term action combined with longer-term change. So in the short term, I look to the leaders within the HSE to listen to staff and to listen to patients in order to maximise our ability to secure improvement. We will, however, need to be more far-sighted, strategic and inclusive about how we plan our services to bring about radical long-term and sustainable reform. I think that there is consensus that our commissioning and planning systems are not working as well as they could be, and work is ongoing on the design of the new structures, and I will take some time to consider the proposals that are emerging from that work, and I will then make decisions about the way forward based on what I believe to be the optimal model for effective and sustainable planning, commissioning and performance management of HSE services to supply the delivery of better outcomes for all of our people. Again, I can't emphasise enough that these changes are about structures and not about people or savings. Right across the HSE, there are many talented people doing many important things to a very high standard, and we need to ensure that they are supported in doing so. Transformation means making better use of opportunities, such as developing all island networks to tap into the benefits that cooperation on health and social care brings, building on the good work that is already underway. My department and the Department of Health have for some time worked together on the issues of common good to the population of the whole island, with the Radiotherapy Centre at Altnagevan and Paediatric Cardiology, but two of the more well-publicised areas of cooperation. I've spoken with my counterpart, Simon Harris TD, about the scope of extending all-island approaches in health issues, and likewise, my department and the Department of Children and Youth Affairs have a good record of cooperative working on child protection issues. The two departments routinely share learning and experience, both through formal conferences and through exchange of key protocols and guidance. I'm delighted to see such a high level of cooperation and look forward to meeting with my counterpart, Dr. Catherine Sapone, who's the Minister for Children and Youth Affairs. Having appropriate structures in place will enhance the changes. Being able to reduce health inequalities, and reducing health inequalities is a priority for me. We need to ensure that everyone has the same chance of living long and healthy life no matter where they live, with an emphasis on embedding prevention and early intervention within the HSE. A key priority for me, therefore, as set out in the draft programme for government, will be to improve the physical and mental health and well-being of everyone in the North. But this is not an issue my department alone can address. This is an issue for all parts of government. For me to deliver services to the most vulnerable, we need to change the way that we do things. We're all aware that the health and social care system is facing huge challenges due to an ageing population, increased demand and constrained resources. However, it's not simply enough to manage these challenges. We must respond to them and put the system on a more sustainable footing. Reform of this scale and complexity will take time. It's therefore crucial that in the meantime we continue to provide high quality health and social care services for the most vulnerable in our society. To enable me to champion mental health, more needs to be done. Mental health services have come a very long way since the Bamford Review. Funding is now £250 million annually. There is a new care pathway designed to promote recovery. Nearly 60% of mental health funding is spent on community services compared to 40% a decade ago. There is more early intervention, crisis response, home treatment and use of evidence-based psychological therapies. However, funding issues and service provision issues remain. Officials are currently working on the evaluation report of the most recent Bamford Action Plan. The report will detail service needs once we have identified the gaps, and I hope that there can be consensus on prioritising and resourcing improvements, because I believe we can certainly do more in relation to mental health. Finally, as members of the Legislative Assembly and the committee in particular will have an important role in scrutinising both primary and subordinate legislation throughout this mandate. It's early days yet, and I have yet to make decisions on what legislation to initiate. However, I am aware that any reform of health and social care will likely require legislative change, but I intend to keep the committee up to date and give you a clearer picture of my idea of the legislative programme as soon as it's known to me when I've done a bit more homework. So I think that there's a huge agenda, many challenges for me to take on as Health Minister, many things that I think that we can do better, but I want to work with the committee and being able to do that. I want to work with those people that work on the front line and actually know exactly how the service delivers for people, and also to work with patients. So I really look forward to working with the committee, taking on the challenges, but I do think that we actually have a real opportunity here to actually reconfigure the health service, to actually look at how we can do better and how we can deliver services better that gets us to the position where we can invest more in early intervention, prevention and promote health promotion. So thank you, Chair.
Thank you, Minister. And I think you're absolutely right. I think there's a massive appetite out there amongst health and social care staff to see a complete transformation and reconfiguration. And even within this committee, I think that we're very much committed to seeing that happen as well. So we look forward to the coming months and years of working together and how we can do that. If I could just bring the Minister back, you mentioned there to do with the programme for government, and we know out of the 42 indicators on that, many of which were either directly or indirectly related to health. And I suppose want to ask the Minister, will there be individual action plans put in place for those indicators? I know that you've been asked before about targets and timelines, and I know it's still early days to be asking you to set those targets. But I suppose I want to know, will you be intending to do that? And I suppose the timeline for the development of the indicators within the programme for government?
I think the programme for government certainly offers us a real opportunity to do things differently, and actually to have that, to break away from the silo mentality of departments working in their own areas. I think the programme for government, because it's going to be so outcomes focused, is certainly something that I'm picking up is very much welcome out there among all different sectors. So I think we have a real opportunity to actually transform actually how we as an executive deliver services. The programme for government itself is obviously very high level, and there are some indicators that are relevant to us and a lot of cross-cutting indicators which would be very relevant to the department. Over the coming months, senior responsible officers are going to work to develop action plans for each indicator. So I suppose that'll set out the type of detail that you're talking about. We're obviously currently out to consultation, and we're getting good positive feedback in terms of what people would like to see in terms of those action plans. But we'll identify the action plans for each indicator, and they'll also identify who are the key stakeholders and the partners, which will set out the activities that will help to achieve success. So I think that it's a good time actually, and we're encouraging everybody to respond to that consultation and actually make sure your voice is heard in terms of how the final programme for government looks like.
I suppose another add-on question onto that is to do with the, we know that the expert panel and the Professor Bengoa report is due pretty soon, and do you see that, how that's going to work in with the programme for government?
Yes, I think so. I think that certainly from my engagement over the last, I think I've been posting about 4 or 5 weeks, and I think over that time when I'm engaging with clinicians, people out who work within the health service, they're so keen for us to actually set out a vision and actually move forward. I think there is a wee bit of report fatigue, and I think maybe Paula and I talked about this in chamber in questions one day. There's a bit of report fatigue. We've had everything from Morris Hayes right through to the Donaldson Review, Transforming Care and everything. So a lot of the work has been done. I think the work that Professor Bengoa is going to do is key in terms of bringing it all together and actually setting out the vision as how we can actually do things differently. I really want to transform the health service and get to the point where we actually are really seriously investing in early intervention and actually tackling root causes of why people get sick in the first place. But if we keep doing things the way we continue to do them, then we're not going to solve anything. We're going to continually have these problems with funding and just never been able to have enough for the health service. So it's so important that we get this right. There's a will out there among healthcare workers. I can certainly pick that up. There's a will out there, I think, at a political level to actually transform how we deliver services. And Professor Bengoa has been very clear. It's not about closing services. It's about maybe specialising. It's about how we do things better. And it's about how can we support our healthcare workers to do the excellent job which they do, because they obviously are the biggest asset in the health service. So I look forward to receiving his report. Hopefully, certainly early summer, we intend to receive that report, and then hopefully early in September, being able to actually outline a vision of actually how we go forward. And then I see it as my job as the Minister to actually go out and actually engage with people and actually get all those people, and I'm talking about patients, carers, service users, the healthcare workers, the staff themselves, to actually come on board with that vision, and let's go out and actually make a real difference. These are not things that we're going to do overnight, but I think that with the right will we actually can transform and actually shift the focus in the healthcare.
Okay, thank you, Minister. I'm going to open up for members, and I have Catherine, then Pat, and then Paula. So, Catherine.
Yes, and thank you, Minister, for coming before us today. And I mean, I'm definitely heartened by the fact that you continuously push the fact that mental health is going to be one of your key priorities and addressing gaps in provision. Also think it's an exciting time to be on this committee, given that there is a will, both with yourself, the department and NHS staff, to look to a restructure so that we can deliver our services better. And also I think frontline staff are under severe pressure at the moment, and I think that restructuring would certainly help. I have 2 questions, if that's okay. The first question is as a result of extensive lobbying I've received in Upper Bann, and it's as a result of a move from single pay to the single pay frequency to monthly pay. There is a fear out there that will impact particularly on the lower paid workers within the Southern Trust. So it's just to ask you, have you had any engagement or plan to have any engagement with unions and with the Trust to resolve that? The second one is in relation to Craigavon Hospital, and I met the Chief Executive last week, and I mean, he'll be keen for me to say that we would love our hospital to be refurbed over the coming years, but I know and welcome that there's a new paediatric section going into Craigavon Hospital, and I would ask that you would consider, along with your department officials, a space within there for those parents whose children are born sleeping or stillborn, that they have a space to themselves in order to go through the process of grieving and coming to terms with that. So just that would be a consideration. Thank you.
Okay, thanks. Yes, I think that in relation to the single pay frequency, it's an issue which has been brought to my attention. and I am particularly concerned by the fact that it does affect predominantly women and also low-paid workers. So I think that we need to take, I need to give due consideration to actually the implications for that. As a matter of fact, I'm actually meeting the unions, the representative of all the unions this afternoon, and I'm sure it's one of the issues which we will discuss as part of our agenda. It's more of a meet and greet type meeting, but I think that this is one of the issues which obviously they'll be keen to talk about. I think anything, when you're, any element of the health and social care are taking decisions, if there is an issue which I suppose impacts on women more so and impacts in terms of low-paid workers, then there needs to be really, really serious consideration given to how that's actually managed and taken forward. So I will be giving that a lot of attention over the coming weeks, and I will talk to the unions about it, and I will be talking to my officials about it as well, just in relation to how it's taken forward. In relation to Craigavon Area Hospital, actually it was one of the first hospitals that I visited when I came into post, and they made me very aware of their plans and their need for capital investment on the site. I think that it is great to see the new paediatric area being built, and I was able to actually go on site and actually see some of the work that's ongoing. I think it's going to be a fantastic enhancement to the hospital. The staff are very passionate about it, and I think it'll make a real difference to families whenever their children are receiving treatment. You'll know that it's also there's a complementary piece of work happening in Daisy Hill, so Daisy Hill and Craigavon will complement each other in terms of paediatric services. I will, in terms of I did look at the plans. I can't remember if there was a room for parents whose children are born sleeping, but I'll certainly give it some consideration and talk to officials in the trust about that.
Thank you.
Thanks.
Okay, thank you. Pat?
Thanks, Chair. I welcome your visit, Michelle, to the Fallswater and Ravenhill Day Centres, and of course the decision by the Trust to keep those centres open and other centres in Belfast, although I know ultimately that decision comes to your desk and you make a decision on it. But I mean, it has been a victory for, listening to service users and engagement with the people and the families of those who use the centres. I'm just wondering, is this the start? Is this the way you mean to carry on in your ministry? That there'll be a process of listening and engagement with service users, with staff, with patients, and so on?
Yes, I mean, absolutely. I think that if we're going to be serious about transforming health and social care, we have to take everybody with us. People need to understand why we're doing it, and that allows them then to take ownership of it and also buy into the process, that it's about trying to improve services for them as individuals. So actually one of the events I attended yesterday was PPA, which is around patients, carers, service users actually having their voice heard, and one of the messages they made very clear to me was they don't want the health service to come to them with a fait accompli. They don't want to come and say this is how we're going to do something. They want to be engaged from the very start of the process. So I give a commitment that is what I want to do, and we have within trusts coordinators, people who will actually do that, but I think we need to do a lot more of it. And in my tenure as Minister, I will make sure that I properly engage with people. You raised the issue of the day centres in Belfast, and I think that was a victory for consultation. I think whenever the service users asked me to come along and I spoke to them, they made their views very, very clear that they didn't feel that they were consulted properly, and that was a problem. I gave them an undertaking to listen to them, and I very clearly heard what they said. So I welcome the fact that the Trust Board is now in their public meeting announced that they won't close the day centres, that they'll actually work with individuals in terms of what's good for them as individuals, because there's no blanket approach here. I think what suits one person with a learning disability mightn't be what suits another, and that very much came across in the meeting. So I committed that day that I would ask the Trust to properly engage with these people, because we want real and meaningful engagement, not just ticking a box and saying that you've consulted. So I want to make sure that in my tenure that I will properly engage with people, and because I do think that, particularly if you use the day centres in Belfast as an example, those service users were actually quite open to looking at new ways of achieving day opportunities and what would be good for them. But I don't think they were consulted properly or taken along. It wasn't properly explained, and I think that they needed to be part of that decision making, because these are vulnerable people who need extra support. So I think that Bamford Vision set out very clearly that we needed to not just have day centres where people go to every day. We needed to have a mix of actually how you provide opportunities. So I want to make sure that that is how we actually do things in the future. So I think it really was a victory for consultation in terms of the decision in relation to the day centres in Belfast.
Okay, thanks.
Okay, thank you. Paula?
Thank you, Chair, and thank you, Michelle, for that presentation. I've sort of two separate lines of questions, so I'll maybe do one and then come back to the other one. And it's really about the programme for government in terms of your indicators, and I welcome the reference a couple of times there around errors, and I'm just wondering if is there any way that within the programme for government phrasing you could maybe put in something about specific support for carers, and also then something about specifying people with long-term conditions are entitled to healthy life. I just think that there's a bit of a crossover there in terms of in terms of a potential indicator around enabling carers of people with long-term conditions to live healthy and full lives with appropriate support and respite supervision. A lot of the constituents who've contacted me recently are in this category, and whilst people are living with conditions, a lot of the people who are caring for them have got an awful lot of mental health issues and a lot of strain and stress on their own lives. So I just think that we need to give cognizance to that body of people who are providing that service free in most cases. Is there anything around that?
Yeah, well, I think that obviously it's very outcomes focused, and whilst you're making the case for carers, and I can hear you and understand exactly why you're making the case. Yesterday when I met the Older Persons Commissioner, they would make the case that we should have older people specifically referenced in it. So I think there's a balance to be got about how we take it forward. Okay. So, I mean, I think whenever you delve down into the sort of actions and the action plans, there may be specific references to particular groups, and maybe that's how it will be taken forward. Okay. But I encourage you actually just to feed that into the consultation. Okay. I'll take on board what you're saying. Yeah. But I suppose depending on what area, particularly as I said, the Older Persons Commissioner were arguing for why they would, and I can actually understand the arguments for why anybody would put that forward. But maybe it'd be more in terms of the action plans as opposed to the actual sort of high-level indicators. But okay. I will take it on board. Okay, thank you. And the second area I'm interested in is around the proposed framework looking at the fetal abnormality in pregnancy, and I'm just wondering whether it's your view, I know you're only in post a few weeks, but is it your view that there will be the need for further consultation around this over and above what the Justice Minister carried out last year, or do you think that the working group will have enough information in front of them to make a decision quite quickly? Yes, well obviously the Executive announced the working group, and I'm currently looking at the terms of reference. They weren't obviously signed off on in the previous mandate. So I'm looking at the terms of reference, and I want to engage with Claire Sultan, obviously the Justice Minister, because ultimately it will be her responsibility to take forward any recommendation to legislative change. I have my own personal view in relation to the issue, but it's important that I look at what the evidence is in front of me. But I want to work with the Justice Minister actually in making sure that we take a decision how we move forward in this as quickly as possible. So her and I actually have a meeting scheduled over the next number of weeks where we're going to actually discuss that issue, and I hope to have that working group up and established as quickly as possible over the next number of weeks, which will allow us then to actually gather the information and make a recommendation then that'll come forward to Executive on the floor of the Assembly. Okay, thank you. Thank you, Chair. Terry?
Thanks, Chair, and thanks, Minister, for your presentation. I know you're just in the post, and I think your term was you still work or homework to do. But just to ask you, has there been any assessment or plans to look at the implementation of the living wage within the health service? I think it's fundamentally about equality for workers in terms of low-paid workers here compared with how they're paid in England, Scotland and Wales. There's also an issue of low pay generally for workers in the north, and I know it's an issue that her party supports. So I just want to ask, I know it's early days, but has there been any assessment or plans to look at the implementation of the living wage and health service? Thanks.
Yeah, I think there's always a difference between what the British Tory government set out as a living wage and what is an actual real living wage, and I think we can share the same view in terms of that. I think that yes, I would ultimately want to get to the position where we could pay a real living wage. I think the financial constraints that we're working under now makes it extremely difficult to be able to do anything in that field, but I do think that if we can move forward with transformation and actually how we deliver services, it allows us to have more money to invest in what I would want to do is more health promotion, early intervention, and the biggest asset which we have, which is our staff. We have so many people who work in the health service who are on low pay, domiciliary care workers, all those people that work in our hospitals, who really are ultimately the front line of the health service, who provide excellent service, who prevent people from having to go into hospitals, in particular in relation to domiciliary care workers. So there's so many challenges there in terms of workforce. So I only want to work with the unions. I want to work with all the staff out there that actually provide excellent service. I don't think I can change the picture overnight, but I certainly believe I can change the picture in time. But I think that we need for a win, we need political buy-in, and we need people to actually help me to actually transform the health service. That's the message that I'm putting out there till any groupings that I'm engaging with. Help me to transform the health service, which allows me to do more of the things that we'd want to do. And in my opinion, I would want to get to the point where we actually are able to pay a proper living wage for staff.
Okay, all right, Chair.
Okay,
Thank
thanks.
you. Gary?
Thanks, Chair, and can I welcome the Minister and Richard to the meeting. Minister, I welcome your statement today and your priorities, and I read a statement that you made yesterday at the Together For You conference around your focus about champion mental health, and I think that's welcome. Not to preempt a motion that's coming to the Chamber next week, but there is a feeling, and we had it in our own particular manifesto, and I know other parties share that view, that there would be a need for to appoint a champion for mental health, and I wanted to get your views on that. But also, you mentioned the fact that we spend 250 million annually on the area of mental health, and 60% go to community services. I think I'm right in that. Within our own individual areas, we know there's many organisations and charities which do fantastic work, but there's a feeling that there's a silo mentality at times within those organisations, and if we could, and other ministers have tried to do this, bring those groups together as best as we can to try and ensure there's no duplication around services, but the people who are vulnerable have an easier way of getting access to those services, bringing them under one roof, creating sort of mental health centres. The other question is around specifically the Western Trust, and we know living in the West there's specific challenges to those areas. We had the chief executives here last week, and Elaine Way did highlight the fact that serious pressures around attracting medical professionals to the West, and the serious bill faced in recruiting locum doctors as well. So it's just, how do you see those areas being addressed?
Mm-hmm. Okay. Yeah, the conference I spoke at yesterday was the Together For You conference, and actually, I think it was a brilliant example of actually how groups actually work together, because it was the lottery-funded project, which meant that mental health charities within the community voluntary sector worked together to deliver services to people who needed them. And what the groups were saying to me yesterday was they never worked together before, which they all knew what each other did, but they never actually collectively worked together before. And I think that in itself, that project over the last number of years, it maybe set a wee bit of a mindset change around how they actually can deliver services more. I think whenever we look towards, that Simon Hamilton had previously announced a change to actually how we fund some of the community voluntary sector groups, and we look at more ways of being innovative in how you deliver services, I think that in itself will also encourage some of these groups to work together, and it's just we have to be smarter about how we deliver services in this. And I think that if we have to be smarter within the government, within departments, then we also need to be smarter in the community and voluntary sector about how we do that. So I want to work with them and see if we can support them to do that. I think that the whole mental health, as I said, mental health is going to be a priority for me. And whenever you look at spend compared in the last decade, we're spending 50 million more now per year than we were previously. We're doing a lot more services in the community, 60-40, 60% in the community, 40 in statutory. I think that shows that we are moving in the right direction in terms of the Bamford vision and the whole shift towards community services. But I do think that we still have a lot, we have a way to go, and we need to work collectively to be able to deliver more and do more. I certainly want to get to the point where we're actually having proper perinatal services, so for women in pregnancy and mental health. I want to be able to deliver on those things, so I think that we just need to, I feel like I need to bring a real focus to this issue, and I want to do that in my time as Minister. Your point in relation to mental health champion, then, as I said at the conference, I will be a mental health champion, but I know there is some calls out there for a champion. I think we need to really scope out what that champion and how that would look. Because, for example, in its simplest form, if I was to appoint a champion, where's the conflict there? Where's the challenge function? I think we just need to be very careful about how we would take it forward. So I think we just need to do a wee bit more work in terms of what it looks like, and if it is something that's real and something that's needed. Because is the money better spent in creating an office for a champion, or is the money better spent in frontline services? So I just think we need to get a balance. So I'll take all decisions based on evidence. So I'll need to build a case just to see if that's what we should do. So I know we are going to have a debate on that in the Chamber next week. The Western Trust, then you raised issues of, what was it? Locums,
and attracting medical professionals to
yeah, it's extremely challenging, I think, to get the Trust are saying that it's extremely challenging in terms of attracting locums. We are looking at working with University of Ulster to see if, do you want to maybe just give a wee bit of detail of that, because I think maybe that will hopefully maybe try and change the picture of, apparently if doctors train in a certain area, maybe they're more likely to stay in the area. So I think that there's maybe some scope there and some potential for us to maybe shift that picture around people actually wanting to work in rural areas and work in the Western end. So.
Yeah, I think one of the key challenges for the Western Trust is just geographical remoteness. There is emerging evidence that doctors tend to take up employment where they train. The University of Ulster have a proposal to establish a graduate entry medical school in the northwest. As well as being a place that would serve both the Western Trust and probably the top half, if I can call it that way, of the Northern Trust, they would also want to focus the programme more on primary care than is the case with the current medical training at Queen's, which is absolutely plays the direction of travel the Minister set out about a greater focus on primary and community care. So it's a very exciting proposal. It's in its early stage, but they're wanting to ramp up activity on that. I think it can address a number of issues for us.
I think just do a follow-up to that. Well, I know I've certainly been made aware, I'm sure other members have been made aware, I'm sure you're well aware of the issues surrounding GPs in County Fermanagh and County Tyrone, and I know I've heard recently of closures of various surgeries, and we're down to very low numbers of surgeries in County Fermanagh. And I know from our witness session last week with Michael McBride, the issue around GP and recruiting GPs. So I would assume that some of that action that's being taken is going to have a direct effect on that. I know in the last mandate, Simon had, was it an extra 100 places that he had looked at, or 85 was it? Yeah, it's just to see if any further plans on increasing that, or what we do with that.
I think we'll have to look at all of that. I mean, there was I think we all can recognise the role that GPs play, and I think as part of the whole transformation of the health service, if we're going to focus more on primary care, we need to support GPs to do the job that they do, but not just GPs. I think we need to have the whole primary care service working together. So we need to explore more and support more the idea of GP federations, of integrated care partnerships, so all the services working together. So your community health visitor, you could have your allied health professionals, so your physiotherapists, all those services actually all working together and actually putting more of that focus in primary care, which will ultimately lead to less hospital admissions, it lead to less people needing emergency department time. So I think that if we can get this whole picture right, I think we can help every element of the health service to deliver better. And that's what I think that Professor Bengoa is going to really focus on. There was, obviously, there's particular challenges given that we have rising demand, but we also have the ageing GP workforce. So there are all particular challenges that we have to address, and there was an additional GP training place that started for this year, and we're also working with pharmacy and on all the other elements. So I think that we need to do more of that, and I'm actually meeting with the BMA, and I want to continue to chat to them about how we can address some of the challenges, particularly even out of our services, for example, particularly in the West again, very challenging. So we need to support these people to do the job.
If it's not challenged very quickly, what the problems that are happening in the West and all rural parts of Northern Ireland it will then start having the same effect in our own constituencies in Belfast as well. We kind of, as Belfast representatives, a lot of us think that problem will not happen to us, but it will eventually happen. Yeah. And I know this is cyclical, and I know that it has come round to that stage where we do have a great problem with GPs. But I also understand, and I totally agree with the Minister, that they are the cornerstone, and that will take the care within the community, and it's the same even with senior nurse practitioners working in GP surgeries and pharmacists now being placed there. I mean, these are good pilots that are definitely looking to the future. Yeah. But there's a major concern out there amongst my rural colleagues of just how this is going to manifest itself over the coming years. So I'm glad that There's also a working group that's been established to consider the delivery of services that are provided in GP surgeries. So I think that'll feed in very well with that. Yesterday, actually, when I was out at an integrated care partnership event, one of the doctors referred to the fact that because he specialised in diabetes care, he was able to prevent 10 amputations. And that's real tangible delivery where you can see how they made a difference if we support them at that level.
to be able to specialise and actually do something differently. So I think that that's the vision, that's where we want to be. We want to be able to support the primary care, but we have to obviously transform the service to allow us to have the investment to do so.
Gary, you want to come back in?
Just a last point in relation to the Western Trust. It was mentioned at question time, your previous question time, around the serious issue about the deficit and adult learning disability funding in the West. A serious issue running into millions of pounds. Can you, Minister, give a commitment that there will be an investigation as to why this happened over a period of 20 years? Obviously, the families feel obviously devastated, and in fairness to the Trust, they have outlined a number of actions that they're going to take over the course of the next number of months. But I think it's important that we find out exactly how it happened and why it happened to ensure that obviously it doesn't happen again. Yes,
absolutely, and I think we can all fully understand the concerns that have been expressed by the families and the carers. It's absolutely natural reaction. So it was one of the very first issues actually that came to my attention when I came into post, and I'd asked for a briefing on it, and we're actively working our way through it. The Trust have given assurances now that they will work with the department. We've also asked the board to work with the Trust around being able to, one, quantify, because obviously there's a figure of 8 million that's been put out there, but we're not sure if that's actually the right correct figure. So we need to, one, quantify the problem, but also, two, then put in place a proper plan to actually address the problem and address the gap, which they've been asked to do. I know Richard's also been engaged with the Trust also to try and iron out all of this, but I think it's important that people have clarity. Certainly I don't think it was handled in the way it should be, and I would absolutely recognise that. But it's important, again, these are people with learning difficulties, families who usually have had to fight tooth and nail for the services that they have in a lot of instances, so I think that it's important that they're given every support and they're given every piece of information that they need.
Thank you.
Okay, Mark?
Okay, thank you, Chair, and thank the Minister for coming today, and also to commend the Minister for what's been an extremely positive start to your ministry, and to do my Hebra, as they say. The Chair had asked earlier around targets, and more specifically around targets and for the programme for government, and the issue of waiting lists had also been touched on by yourself and the Chair. We don't need to wait for the programme for government, or targets don't have to be in the programme for government. There can be just, I suppose, performance targets set across the department and then across the Trust. I don't know, was it your intention, or is it your intention to actually set targets when it comes to reducing waiting lists as well? And I fully accept and endorse or agree with your desire to tackle, or determination to tackle, the root causes of these waiting lists. I think that's something we all want to do, rather than just having to come back monitoring round after monitoring round to try and get a quick fix. A lot of the people around the table here have spoken about mental health, and I think that's reflective of, I think, the growing demand for mental health services, and hopefully that growing demand is in itself maybe reflective of a reduction in the stigma around mental illness. I know it's reflected again just in my own constituency, but there is a genuine difficulty out there that people have actually accessing services. And I know you spoke of the new pathway, but I'm picking up that the new pathway isn't necessarily the quickest way to get from A to B, where people want to be or need to be, and that it is littered with obstacles. So I think it's important that you do work with, and I know you have given the commitment to work with other groups, even non-statutory groups, to identify a better pathway. Or there'll never be a perfect one, but there'll definitely be better ones. With regards to mental health and indeed physical health, the importance of prevention and early intervention, is something that you have remarked on as well, and that brings me to the monitoring round. We have a wee sort of simplified table here of what was got and where it went. It's simplified, but not simplified enough for me, sadly. And it's just in terms of the public health services, the reduction and the money for that. I wonder if you could maybe, or Richard could maybe outline why that is? You know, was it not able to be spent, or would it not be able to be spent, or where else it's going? And I know it's good that additional money was given to the health department. 50 million is going to hospital services, which is very general. I wonder, could you maybe be a wee bit more specific about what that is?
Budget in general. Just the budget in general. You're talking about the allocations for this year.
Yeah. But I wonder, was any of that allocation to health, you know, going to go to the trusts to help them with the new burden that they're facing around employers' contribution and superannuation requirements? I know, again, that's something that all departments are having to deal with, but the Department of Health and trusts have responsibility for an awful lot of employees across the north. You spoke of the opportunity that the Bengoa report will provide us with to transform the health system. These opportunities have been presented to us collectively, I suppose, before and not taken. And I think that's why that's because they haven't adequately or been adequately resourced, and it's imperative that you make as much noise as you can, and we make as much noise to support you, to ensure that you do get, or the department does get, the adequate funding to ensure that it is resourced. In terms of north-south collaboration, this is something I asked you on in question time just past, but it is something that does genuinely concern me, and I know it's D-Day today or election day in terms of a referendum day. That cooperation and collaboration, it's extremely welcome, but it's not as straightforward as it should be, as it is. And I do have genuine concerns that in the event of us coming out of Europe, that it might become more so. I was wondering if you had any indication that would be the case, or can you give us an assurance that it wouldn't? And then finally, just touching on some more local issues, and that Gary had raised them around the difficulty that the Western Trust in particular does have in attracting staff. I welcome that work being done going forward and looking at getting something set up. I don't know if it would be a fully fledged medical school, but working with the university, because people will stay where they study. But I'm also aware, at least I think I'm aware, that work is currently being done, a sort of recalibration of the existing capitation formula, and I know rurality is already reflected in the existing formula, but I think more emphasis might need to be put on that, given the fact that there's actually a growing spend in that trust area on locums and the agency staff, and the more that they spend or have to spend there, the less they have to spend on frontline services. Although I know they're providing a frontline service, but you know what I mean.
Just before the Minister answers, can I just remind that anything to do with the EU referendum and transmission of our debate today, we need to be extremely careful as to what we say on that. So it's just to remind the Minister and the member of that.
Thank you, Chair.
We're fine from next week, but this is the actual day, just to remind. We need to be quite careful.
Okay. I think there's a number of things in there. A lot of them are tied up together, but I think that whenever you've obviously set out that you understand the need for reform and actually how we deliver services better. And I think that starts with political leadership. And I think that's, if we have political leadership, I think there's certainly a willingness out there within all the health professions to actually also show that leadership. In my early conversation with representatives of the Professional Bengoa's panel, I think that one of the things they were saying was that there was one voice within the clinicians which they've been engaging with. And I'm certainly picking that up too. There's also a recognition that the clinicians also need to speak out and say why there's a need for change, because they're obviously providing the services. Mm-hmm. And I think that if we all can get to the stage where we're all actually saying the same thing, that our health staff understand, that the patients and carers understand why we're trying to transform things. It's about making services better, and it's about allowing us to invest in areas where we want to invest, particularly in relation to preventative work, health promotion, mental health, tackling health inequalities. So if you take that picture, you know, the current finances, as I said in my opening remarks, the block grant's been cut year on year, but yet, despite that, the Executive has protected the health budget. But the health budget is under extreme challenges, and the only way It's said also at the start, I said that if we keep doing things the same way, we're always going to get the same outcome. So we have to transform services to allow us to have more money, to allow us to do other things. I think that when you look at the health budget for this year, whilst we had a certain amount of an uplift, and then obviously in the recent June monitoring been able to achieve the extra 67 million, while 67 million sounds like an additional, whilst it is an additional investment, it doesn't go anywhere near dealing with all the challenges that we have in the health service, and it doesn't allow you to do all the things that I would want to do. So I have very, very tough decisions to make, a very, very tough challenges ahead of me, I believe, in terms of actually deciding how that money is spent and how it's spent to best effect. But I certainly will take decisions based on equality. I'll take decisions based on needs in the health service, and I'll take decisions based, obviously, in relation to my priorities, which I've identified. I think that whenever we do look at going forward in the vision, and we do need to get smarter about how we do things, and one of the best ways we can do that, and one of the logical ways we can do that, is with all-island cooperation. I've had a conversation with Minister Harris, Simon Harris, and he's certainly up for that also. He has set out his stall in relation to want to develop a 10-year vision for health. So that very much means that we're both on the same page in terms of wanting to move forward and set out how we're going to transform services. We won't always do things the same way, but I do think there's certainly areas where we can cooperate. Anthony Galvin's one good example. Children's paediatric services is also another good example, but there are so many other areas where actually we already collaboratively work, particularly in border areas, and the Western Trust I think is a good example of where they do have actually quite a number of less high profile but nonetheless very effective cooperation services happening. But I want to do more, and he's indicated that he also wants to do more, so I'm going to be meeting him over the next number of weeks, and I hope to be able to really set out how and scope out more what we can do and how we can take it forward. There was a North-South feasibility study done in the past, but it's not, well, in my opinion, a lot of it, whilst all good, I think we need to update it, obviously, and see where else we can work together. So I'm up for doing that. In relation to the capitation funding, the approach is constantly under review, and maybe you want to talk a bit about that?
Yeah, I mean, our approach to capitation funding is constantly under review, and we finesse the numbers. But I think that the point the Minister has indicated to me is that finding more money to give to the Western Trust to meet this bill isn't the answer. That just perpetuates the problem. We need to actually address the core issue about the supply of medical workforce. And so the Minister is very keen to focus on continuing the exploratory talks with the University of Ulster about a graduate entry medical school at Magee, about better and more sensitive workforce planning. And I think it also plays into the transformation piece about getting the right staff with the right expertise at the right part of the country to deliver key services. I think the capitation is a short-term fix, and we will look at that, but we really want to address the problem.
Well, I'm all in favour of the freedom of movement of labour. but I wonder, centrally, was there anything the department could do in terms of, or more that the department could do in terms of ensuring that doctors, or junior doctors in particular, spend a certain time in certain areas?
Well, I think that's all part of the review, and what we're looking at how else we can encourage people to go into a particular area and work with them and actually see that there's a need, let them see how there's a need. So I think that we do need to do a bit more work with that, but I want to work with the BMA and I want to work with the GPs just in relation to how we take it forward, because obviously you need to have them on board with what you would bring forward. And seeing as I have to be careful, obviously we're a small island in relation, we're a small island with two health services back to back. That already creates the first biggest challenge that we have. I think that if we're going to be smarter about doing things, if we're going to work collaboratively across the island, because we know that some of the services that you want to provide, specialist services, need a critical mass of patients, and because we are a small island, it makes a lot of common sense that we actually would specialise in different areas, and we both could bring something, both jurisdictions could bring something to the table in terms of how we take that forward. So that's a big problem already, and if Europe created even more challenges for us, it would make it even more difficult to cooperate. That's me being as sensitive as I could, sure.
Is that everything answered there? I know Mark had a list there.
No, well, I was just scrolling.
No.
Thing about going last. Pick things up.
Dathy?
Thanks, Chair. I also think it's important we stay in Europe, certainly at least the quarter-final stage, anyway. No, Minister, you made a very significant announcement in regard to the MSM blood ban being lifted shortly after you took office, and certainly LGBT health is a huge issue, and they continue to experience poor mental, physical and sexual health outcomes. And certainly I actually spoke to Peter Tatchell at a conference last week. He asked me to pass on his congratulations. He's very happy at the swiftness of that decision. But I wonder if you could outline in terms of those major challenges facing gay people, what are you going to do differently from your predecessors, and also because a lot of these health impacts come through the likes of education in terms of gay people in their formative and teenage years. How will you, and it comes back I suppose to the programme for government in terms of working with other departments, how are you going to work with education in terms of improving health outcomes for young people going through the education system?
Yeah, I mean, obviously I'm a health minister, so it has to be patient first, patient safety first. And I was able to take the decision on the blood ban because I had the evidence from the experts that allowed me to do so. So I was delighted to be able to make that announcement and to take that forward very early in office. And it is something that certainly I've got lots of positive feedback from the LGBT community, who obviously face many inequalities and face many, many challenges. So I think it was a good announcement based on patient safety and based on evidence. And as I said, I like to take decisions that are based on evidence, so it allowed me to do that. In terms of the other challenges for the LGBT community, I actually met with Rainbow Project, and they've identified a number of other areas where they would like to see some movement, and I've committed to actually to continue the conversation with them, actually to look at them. They have particular challenges around lesbian women and IVF treatment. There are particular challenges around quite a number of other areas in terms of access to services and adoption, all those other things that we need to take on. So I'm very keen to work with the LGBT community and make sure that anything I certainly can do in terms of as an individual minister, but also collectively as executive, to make sure that we support people, because I believe in equality and I believe in making sure that we support all people in the community and make sure that we provide first-class services for everybody, regardless of their persuasion, their sexual persuasion.
And in terms of the public health agenda and addressing health inequalities, creating better public health outcomes, what departments do you see alongside your own that you'll be working most significantly with to address that side of things?
I mean, obviously education, you know, I think you could probably find a link to every single department if you look at all of the indicators. Education in relation to working with children with disabilities, special educational needs, our allied health professionals, working more with schools. I think there's a lot of areas for cooperation there. There's a lot of areas in terms of like tackling health inequalities and root causes of why people get sick in the first place isn't just going to be isn't the responsibility of the Department of Health. It's a holistic approach. So it's deprivation, you know, taking people out of poverty. It's about employment. It's about education and access to education. So I think I could very easily find reasons to work with every single department in this executive. And I think this whole approach, the new approach to the programme for government, outcomes focused, is going to force that collaboration. Because as I said earlier, I think that we all recognise in the past departments tended to work in silos. I think this is going to push the boundaries for both the civil service but also for the executive, and I think it's the right thing to do, and I look forward to actually being. I think that we should be able to go out to the public and say this is the outcome that we achieved, and people can measure it for themselves and they can decide for themselves if they believe that the Assembly delivers for them. And I think that that's the challenge for us, and I'm up for doing that in this mandate.
I just want to follow on as well something that Dathy had said there as well, because you will be hearing from me eventually on this, and that's to do with the sexual health strategy, which has lapsed a long time ago. I know we did have at one stage, I think it was a 2-year addendum was attached to the sexual health strategy. So we did look at that in committee when I sat in the committee maybe back in 2012 or so, and we had the PHA and stuff in to look at that, because there's so many issues around underage pregnancy or issues to do with sexuality, lots of issues that I believe that we should be working in collaboration with the Department of Education on that. So that will be something that I know certainly in our strategic planning. I've chaired the sexual health all-party group here for a number of years, and will be part of that in this mandate as well.
Okay,
But that's of
I'm
great
not even sure where it
importance.
sits, Chair, but I'm very happy to look at it and actually
no,
come back and
I've
talk
just
to
thrown
Mike.
that
Yeah,
in
no,
at
fair
you,
enough.
but it is something. But it's very much quite a bit linked to what Dathly was saying there as well. We have so many young people that are not fully aware of even respecting themselves and different things that are happening in their life and how they handle that. And I think a lot of that leads on to poor mental health and other issues that can arise. And I think if we had some sort of sexual health strategy in place, we might be able to address those issues better. So that's something
No, I'm
just
happy,
to
but
throw in.
I'm happy to take it away.
And I
I'm
had
happy to
told
come back
everybody
to you
here
on
that
it,
they weren't to throw things in and they weren't giving you prior notice, and there I've thrown something in.
No, it's
But-
fine. I will take it away and I will come back to you just in relation to where it's at.
Yeah, it's just an issue, just another small issue before and I know I'd brought it up at question time. It was to do with the waiting lists, and I know that's one of your priorities is that we look at the waiting lists, and I know that money has been given through monitoring, so it's just where we are with that, and because I know it's something that you want to see reduced, and we all want to see it reduced. So
I think we certainly all share the desire to have it reduced, and I think that the investments which have happened over the last year have actually made a difference, where we have been able to reach 80,000 people that previously were on the list. But the position still isn't good enough. Unfortunately, we're not going to be able to change it overnight. I think that we are, whilst this additional investment has helped, and it's been able to actually even help us to invest in more diagnostic sort of services, which allows obviously to deal with the issues within the service. But the allocation under June monitoring allows us to do more things, but not necessarily provide the same level of investment. For example, the 30 or the 40 million that was invested in 15-16, which allowed us to reach more people. We've set out that in 16-17 we're going to be able to support an additional 25,000 assessments. But unfortunately, to be upfront about it, I don't see the waiting list picture changing in the immediate future. I think that's the reality. That's why we have to, I suppose, why I keep saying we're coming at it from a short-term point of view, but a longer-term point of view has to be the transformation. But certainly, I'm holding trusts to account and putting pressure on them. We've asked the board to work with them on an elective care plan, and I'm going to be very hands-on in terms of actually how that is implemented. We need to keep pushing to make sure that we're reaching full capacity within each trust, to make sure that they are doing absolutely everything they can do, and that's where I'll be focusing my efforts. And obviously, I will continue to keep pushing for additional resources to allow us to actually treat people and deal with the waiting list. We don't want to be. We're going to continue to have this conversation, I think, until we actually start to really shift the focus in the health service.
Okay, Kathy, you want to back in?
Yeah, just a quick question for Richard. He's getting off a bit lightly there. No, the Dalriada Hospital, I'm aware there's a lot of conversations taking place between different statutory groups, the council, the community, etc. there about the Pathfinder model, and in particular they've looked at the Cornwall Pathfinder, and you referred earlier, Richard, to primary services within the Western and Northern Trust, and certainly that's something that has sparked a lot of interest in this particular model, and some very interesting conversations taking place along the North Coast. I'm just wondering, to what extent is that kind of innovation taking place across the board about reshaping primary services, and if you can give us an update on how things are going in regard to that particular case?
In regard to that particular one, I think that the Northern Trust are very much leading at, and they haven't yet properly engaged with us in terms of where they've got to their thinking, so we can come back to you in terms of their detailed exploration. In terms of the innovation piece generally, I think it's at the heart of what much of the Minister has said about the transformation. At the moment, in many ways, we have a fragmented system, and if you go out and spend time in the system, you will come across amazing examples of innovation. But what is the system we're not good at or good enough at is taking that innovative practice in one area and making it the core way we do business across the province. Now, that's not to say that it needs some variation, particularly if we're taking an urban issue to a rural environment. But there's huge amounts of innovation out there, but as a system, we're not good enough at capturing that. And that's the position the Minister has been absolutely clear with me that she wants to build on. She wants, as part of the transformation, we build on the capacity, and the Minister referenced the spectacularly talented staff we have across the system. We build on what they're doing every day and make that the norm. We actually empower them to take some risks and try some new things, and sometimes that may mean it fails, but you can't really grasp new innovation, new ways of working, unless we legitimise people taking a chance. And we don't ostracise them if it does go wrong. We help them back to their feet, dust them down, and say, have another go, and you'll get it right this time. So that's one of the key parts of the transformation, is that cultural shift.
Okay, Mark, do you want to quickly
It was
come back to
just
something?
one that got away, and I know it raised a lot of points, but it was the one on the monitoring round and the reduction in the public health services budget.
Well, there's no, in relation to the monitoring round and actually how the 67 spent, I still haven't allocated that, so we're working our way through that at the minute, because I think that, as I said, there's very tough decisions to be taken. I think maybe you're referring,
Yes, so
I'm
with that
possibly thinking you're referring to the overall yearly budget, the 16-17 budget.
we have. Yeah, but was there a reduction in public health services from 67.4 million to 56.7?
No,
Not a table that we
it's
have.
not a table that I have, so I don't know what we're looking at.
It was simplified.
but should let me-
Not simplified enough.
Well, I suppose I'll put it simply this way. I don't know the figures, but I'll get a look at it, sure, and I'm happy to come back to you after the meeting. But I want to focus on the public health agenda. I think it's so key and so important that we tackle health inequalities, that we tackle root causes of why people get sick. That's where I want to be. So I want to have a change in picture whenever I set out my vision, which very much shifts the focus where we invest our money in terms of health and social care. And I want the shift to be more towards that area of work. I think there's an OECD average that each health service should be spending at least 6% in preventative work. We don't do that, and that's where I'd certainly want to be.
I think actually, just to come back, because the paper that Mark has, it was more to do, it was actually the Minister for Finance statement
Okay.
that he had
Sure, I can
set
take a
out
look at it, and
this.
I'm happy to
So,
respond to them.
yeah, that's okay. So that's where that comes from, those figures come from, rather than from yourself. Any other members have any other questions that they need to raise at this stage of the Minister? Thank you very much, Minister, and thank you, Richard.
Thank you.
I think we've had a good, positive debate here this morning, and I hope that continues. No doubt there will be occasions when we'll be back and it will not be quite so positive, and you'll not be let off quite so easily. But I think for our first meeting, the beginning of the mandate has been positive.
Thank you, Chair, and thanks to the members also.
Thank you. Thank you. Okay, members. If I can find where we are, we'll be fine. Yeah, right where I am. Okay. Okay, we're going to move on to item number 5 on our agenda, which is the Forward Work Programme. And can I refer members to pages 80-81 of our meeting pack? Can I ask members, are they content to invite the RQIA, the Patient Client Council, the Northern Ireland Ambulance Service Trust and the Northern Ireland Fire and Rescue Service to brief the committee in September and to invite professional bodies and unions after that? Content with that? Members, looking ahead to our strategic planning meeting in September, can I also propose that that meeting is held in the Skenos Centre, which is one of our local, or not one of our local, I suppose, in this area, in East Belfast local community centre. So if members are content with that, that's where we'll hold the meeting.
Sorry, Chair, what date is that strategic plan?
Have we got a date for that yet?
8th of September.
8th of September. Okay, and what I wanted to, I mean, I know a lot of these strategic planning meetings, we go to various places to hold them because they happen every September. We will look at this. So I think it's a good idea that we go out into the community and hold them rather than going to a hotel or wherever else.
Yep.
So I thought we'll start off with the Skenos in East Belfast, and then we'll look at that in the future.
Are
where
we
we're gonna go.
expecting that to be a full day thing, or?
Pretty much, I think it will be. I think it should be a full day. We'll write out to members sooner rather than later on that, because I think it just depends on the issues that we bring up over the summer, and that's why I would encourage members to do that as well, to give the clerk and her team time to prepare for that meeting. So if that's okay. Yeah, we need to we're supposed to get that information back. Is there anything else in that I need to look at? Okay, members, are you content that we write to the department seeking some factual information? Firstly, to inquire what business the department intends to bring forward in coming months, including primary and subordinate legislation and major policy initiatives. And secondly, to request a paper on the 2016-17 departmental budget and how it's broken down and allocated. This will enable us to have more effective engagement with the department and other stakeholders. Are members content with that? And then can I ask our members content to note the forward work programme? Yeah, thank you. Item number 6 is matters arising, and I'll advise members to be glad to hear I have no matters arising to bring to the committee today. We'll move on to item number 7, which is correspondence, and can I advise members that there are 5 items of correspondence which can be found in pages 85 to 90 of the meeting pack. Can I draw members' attention to item 7.4, which is a request that the committee sponsor the 2017 Daffodil Appeal in the Long Gallery on Tuesday the 28th of February. From what we're led to believe, this is something that the committee sponsors regularly, so are members content with that?
Yes.
Okay, are members otherwise content with correspondence? Don't all shout at once?
Chair.
Yeah?
No.
Okay.
Sorry,
Right, go
Claire,
ahead,
I'm
Paula.
just wondering about this. What's the protocol around that letter from the lady regarding her the Gilbraith family? Does that just get referred on, or what?
Yeah, that is the one that, that will be sent. The lady will be advised of her MLAs for the area.
Okay.
So it will. Yeah,
Okay.
that's part of the protocol
but
that we set up at the very beginning, that anything that comes in that is constituency or individual based, we can't deal with that as a committee, but the committee then will write to the person involved advising her 6 MLAs are. And I would hope, actually, from what I received that as well, I think a lot of MLAs, MLAs in that area will have received that.
Okay, so it's been actioned then?
Yeah.
That was- thank you.
Yeah, it will be actioned from the committee to go back to her with the list of MLAs.
Okay,
Okay.
thank you.
All right, item number 8. Any other business? No, no other business. Well, thank you very much, members. Date and time, place of next meeting is 10:30 next Thursday, the 30th of June, and I'll have our last health committee before recess. Thank you.
Thank you, Chair.